8:11 with more of our series Under the Knife, taking a careful look at plastic surgery. This morning, breast augmentation. Dr. Richard D'Amico is the chair of the Breast Implant Task Force for the American Society of Plastic Surgery. He's also the chief of the Department of Plastic Surgery at Inglewood Hospital and Medical Center. Maria Garcia is a patient of Dr. D'Amico who received breast implants this past January, and Brenda De La Casa got breast implants back in 2001. Good morning to all of you. Nice to see you.
Good morning.
All right, so Dr. D'Amico, we've got an awful lot to get through, but you say that breast implant patients fall into two categories, 20-somethings and 40-somethings. Is that right?
Well, yes. It's younger women who didn't get enough breast or self-conscious about their breasts developmentally form one group. And then there's a very different group of women who've perhaps had children, several pregnancies, the passage of time, and they want a little bit of restoration, sometimes a breast lift along with their implant.
A lot of people are disturbed about younger girls going to get breast implants. Is there a cutoff age? Because a lot of girls haven't developed and they're getting them for like their sweet 16 parties or something.
Absolutely. We feel women under 18 should not have cosmetic breast augmentation. Our society feels that way. The FDA feels that way. So that's something we need to discuss with our teenagers and their parents.
All right, Brenda, let's start with you. You went from an A cup to a D cup. Your doctor in Los Angeles actually suggested you go larger.
Right.
Why? I mean, why did you get them, and why did he want you to have bigger breasts?
Well, it's really funny because I got them because I got tired of stuffing tube socks in my bra. I just wanted a little more of a balanced look. And my doctor was telling me that I should go bigger because in his experience, especially being in LA, all the women wish that they went bigger. And I'll tell you, I did for a while.
Really?
Yes, I did.
And what's your method for selecting a size, Dr. D'Amico? I mean, were you surprised that Brenda's doctor wanted her to increase her breasts even more? And it's her decision, isn't it? I mean,
right.
How do you figure that out? Is it a body proportion thing?
You talk to the patient. You spend a lot of time with her. You find out what her needs are, what her desires are, and once you know what she wants, does she want to be proportional to her body? Does she want to be a little more than proportional? And then you counsel her. When women want a radical change in size, I really like to counsel them and look at the long term.
Now, Maria, I know that after a divorce you lost 35 pounds in 7 weeks. Yeah. And you had the surgery in January of this year. You went from a B cup to a C cup. How do you feel about the fact that you did this? And is there a concern about losing weight and then gaining it back? But I'll ask Dr. D'Amico about that in a moment, but how do you feel?
Well, they're confidence builders, particularly at that point in my life when everything was changing, and losing all the weight and having them literally drop. And I caught myself in the mirror one day and said, oh no, we're not, can't.
So you're happy you did this?
Absolutely.
And Dr. D'Amico, what about a weight loss? Is there concern about getting implants after a significant weight loss for fear that the weight will come back and affect the breast like other parts of the body?
That rarely happens, fortunately, so it's not a concern.
All right. Go ahead. I'm sorry, Brenda.
Oh, no, I was going to say, I've lost weight since I've had the implants, and I've noticed that it makes them look bigger. And I never realized that they looked, for me, they tend to look a little more fake the more weight you lose.
Now, there's a psychological component. Do you counsel your patients? Because some people think that plastic surgery is going to result in a whole new life. You know, they're going to get a boyfriend or have greater self-esteem, and that sometimes doesn't happen, really. I mean, at least everything they think will happen with this, right?
Correct. Breast implants can't give you self-esteem if you don't have it already. If you have it, though, it can be a nice boost or enhancement. I think both of these patients are great examples of that. So we need to be very careful as to counseling women on their motivations. This is something they should do for themselves, never for someone else.
They don't last forever, do they? You have to replace them?
Correct. There's no device that lasts forever in the body, whether it's a breast implant, a heart valve, or a hip joint. So at some point, these will all have to be replaced.
Every what?
There's no scheduled maintenance. There are women with 20 and 30 years on their breast implants. So if they're not broke, Katie, we don't fix them.
And I can't let you go without asking about safety and health concerns.
Yes.
I mean, I would be concerned about getting mammograms, scar tissue, and some other health concerns. What can you say to people who are also concerned about those
Sure.
things?
Well, we've put to rest the health concerns about long-term systemic illness, long-term effects on your health. That doesn't happen. Women still need mammograms. You can detect breast cancer just as early with implants as without them.
All right. Well, ladies, thanks so much for coming in. Obviously, you're proud of what you've done. If I have a low-cut shirt, my mother called me right after the show and told me not to wear that again. But anyway, Brenda and Maria and Dr. D'Amico, thanks to all of you.
Thank you.